Hello everyone, and welcome to the Adverse Health Event Reporting in Minnesota Overview webinar. This is Rachel Jokola. I'll be your host for this webinar. I am the Adverse Health Events Program Director at the Department of Health. This webinar is going to be designed for those of you that are new to Adverse Health Events Reporting in Minnesota, or maybe are new to your position and just need a refresher. First, a little bit of history. Minnesota's reporting law was established in 2003. It applies to hospitals and outpatient surgery centers, and there's an annual public report that is released every January. That report contains the number of events by category at each facility, the outcome of that event, so if it was serious injury, death, no harm, etc. And then we also release a consumer companion report on our website as well. The goals of the law is not to punish errors by doctors, nurses, and other healthcare professionals. The goal is really to learn as much as we can about how to prevent these events in the future, but also to hold people and organizations accountable for systems issues that may arise. So the goals of the law have always been to make it a learning system and to have it as non-punitive as possible. Reportable events in Minnesota are based on a list of 29 serious reportable events, which was created by the National Quality Forum, otherwise known as NQF, and was updated in Minnesota legislature in 2013 to add 4 additional events. So now we'll just walk through the list of 29 reportable events. The first category is surgical events, surgery or other invasive procedure performed on the wrong body part. Wrong surgical or other invasive procedure performed, surgery or other invasive procedure performed on the wrong patient, retention of a foreign object, or operating room or post-operative death of an ASA Class 1 patient. The next category is product or device events. These include patient death or serious injury associated with the use of contaminated drugs, devices, or biologics. Patient death or serious injury associated with the use of a device in which the device is used for functions other than intended. Patient death or serious injury associated with intravascular air embolism. Patient protection events include a patient of any age who does not have decision-making capacity discharged to the wrong person. Patient death or serious injury associated with patient elopement or disappearance. Patient suicide, attempted suicide, or self-harm resulting in serious injury or death. The care management events include patient death or serious injury associated with a medication error, patient death or serious injury associated with the unsafe administration of blood or blood products, maternal death or serious injury associated with labor or delivery in a low-risk pregnancy while being cared for in a facility. Stage 3, 4, or unstageable pressure ulcers acquired after admission to a facility, and there are some exclusions there that can be found on our website as well. Artificial insemination with the wrong donor sperm or wrong egg. Patient death or serious injury associated with a fall while being cared for in a facility. The irretrievable loss of an irreplaceable biologic specimen. Patient death or serious injury resulting from failure to follow up or communicate laboratory, pathology, or radiology test results. The next category is environmental events. These include patient death or serious injury associated with an electric shock while being cared for in a facility, any incident in which a line designated for oxygen or other gas to be delivered to a patient contains the wrong gas or is contaminated by toxic substances, patient death or serious injury associated with a burn incurred from any source while being cared for in a facility, patient death or serious injury associated with the use of or lack of restraints or bed rails while being cared for in a facility. There are also some potential criminal events. Any instance of care ordered by or provided by someone impersonating a physician, nurse, pharmacist, or other licensed healthcare provider, abduction of a patient of any age, sexual assault on a patient within or on the grounds of the facility, Death or serious injury of a patient or staff member resulting from the physical assault that occurs within or on the grounds of a facility. And then radiologic events, this is a new event in 2013, death or serious injury of a patient associated with the introduction of a metallic object into the MRI area. So those are the 29 events that are reportable under this system. So how does the system work? Events are reported through a secure web-based registry which is maintained by the Minnesota Hospital Association. There will be other videos following this video on how to enter an event, how to edit an event, things like that in that web-based registry. So please see those if you're new to reporting as well. Once the event is entered and a root cause analysis has been entered, an independent team reviews, recommends improvements to analysis and corrective actions. We focus on learning and quality improvement. MDH and its partners identify trends and share those trends through safety alerts when needed. And existing MDH regulatory responsibilities are still in place. So what must be reported? You must report the time, location, injury, etc. There are some event-specific questions for certain events such as falls, pressure ulcers, and surgical events. Also, the root cause analysis findings and corrective action plan must be submitted within 60 days of the event as well. Why did the event happen? What role did staffing, communication, training, etc. play in the event? And what are you going to do to help keep this event from happening again? So the timeline for reporting is that the event with basic information must be reported through the online portal within 15 business days after discovery of the event. Occasionally, the event date and the event discovery date are not the same. This usually happens with retention of a foreign object that may be found out later. The RCA corrective action plan and measure of success are due into the online portal within 60 calendar days of the discovery date. So you have a little bit of time to get your teams together and really dive into the root cause. So for more information, there is our website there. It includes tools and resources on what is reportable, definitions of serious injury and invasive procedures. There's a recommendation and guidance document for help with interpreting the law and its requirements. And there's also a root cause analysis toolkit, which now includes videos of the full root cause analysis training that MDH hosts twice a year. Thank you for listening to this video today, and please tune into the videos that follow for more information on how to enter events and other information.